Okay, so I was asked to present on xylazine, and if anyone else is like me, you might not have heard of this drug before, and so it required a little bit of research on my part to figure out what even is this. It definitely sounds like a medication, and it sounds like a number of medications, and until I went and kind of searched it out, I didn't know much about it, and we'll get into why that might be here in just a second. So I don't have any financial disclosures, unfortunately. I have some objectives there, but we're basically just going to talk about xylazine and what it is. And honestly, I probably won't have too terribly long. This might be a little bit of a shorter presentation because we know kind of the basics about xylazine, but as far as in patients and in humans, we don't know a ton about it. And why is that? It's because it's a veterinary tranquilizer. Usually used to put down livestock, to sedate livestock and other animals during procedures and surgeries. And so its straight name is Tranq. Some brand names that you'll see for xylazine are Rompin, Sedzine, and Anaced. And it is an alpha-2 agonist, which is similar to some medications that we do use in humans, such as clonidine. And the way that it works is it acts centrally in the brain to basically tamp down the release of norepinephrine and kind of slow everything down. Now, that's kind of the generally understood mechanism of action, but it also might have some other mechanisms in humans, such as cholinergic actions, serotonergic actions, dopaminergic, alpha-1 action, histaminergic action, and maybe even some opioid receptor mechanisms that we don't really understand right now. Xylazine originally was used or was studied in humans. However, we found that the side effects were so unbearable for patients that they ended up stopping the trials early. And so it didn't even really make it to where we got to research and understand what happens in humans. So then, the question is, and hold on one second, I'm trying to remember I'll talk about it later, kind of the difference between alpha-1 and alpha-2 and some of those and why that matters. So then the question is, if it's used in animals, why are we seeing it being misused in humans? And so it's frequently used with fentanyl to prolong euphoric effects. So by itself, fentanyl can last a few hours, 2 to 4 hours. But if you combine it with xylazine, you can extend that euphoria and that feeling for up to 8 hours. And so we're not really sure exactly what the mechanism is for this. I was trying to look to see and figure out, is this a drug interaction? Is it the mechanism? But again, we don't fully understand the mechanism in humans per se. It might just be that some of those sedating effects from the xylazine make it feel like an extended euphoria or an extended high with the fentanyl. We're not really sure. Along with this, we're also seeing that xylazine is being used to lace drugs and opioids. And so some users, some patients that use this substance or use fentanyl or some other substance that they're buying off the street might have whatever substance that is laced with xylazine. And also, forgive me, I said users and I should not have said that term, but patients that are seeking recreational drugs on the street may have their drug laced with xylazine. And there are some pretty scary unintended consequences from that we'll talk about later. So, are we hung up? Okay, never mind, we're good. Still moving. All right, so who is using xylazine? We don't really know a whole lot yet. There are a couple of reports that have come out, morbidity and mortality weekly reports that have kind of looked at this. There was a big study of the state unintentional drug overdose reporting system, and they pulled data from 2019 to look at overdose deaths to examine how many of those had xylazine listed either in a postmortem report or found in toxicology, or whether they found paraphernalia or xylazine at the scene of the overdose. And so these are some of the statistics that they gleaned from that. There are obviously some limitations to that as far as did they actually test for xylazine? This isn't something that's necessarily on everybody's radar so far. But out of the 45,000, over 45,000 overdose deaths that they saw in 2019, very few of them were from xylazine. I'm sorry, I should have put some more. Only like 1% of them had xylazine in it. So it was a very small amount. But out of those that had xylazine, 73% of them were male, 75% were non-Hispanic white persons, and 67% of those were up in the Northeast region. So where they have started to identify xylazine being used thus far has been up in like Pennsylvania, Connecticut, Rhode Island. That's where the statistics that we have right now are coming from. But I have noted in several articles where they say it's making its way west. I also got online or on some of the online communities like Reddit to see like if anybody had used xylazine and what they were saying about it. There's really not a ton out there. There were a lot of people that were saying that they were from the Philadelphia area, saying that it seems like xylazine has been lacing a lot of the fentanyl that or other opioids that people are trying to get off the street, which I found pretty interesting. All right, so side effects of xylazine. Again, it is an alpha-2 agonist, so it acts similar to clonidine. We know clonidine is used to lower blood pressure, so it causes can cause hypotension, can cause some bradycardia. It increases the risk of opioid overdose when used concomitantly with opioids, can cause CNS depression, respiratory depression, hypotension. One of the side effects that stopped the trials that they were doing on humans was hyperglycemia, so really high blood sugars, which can happen. And then we've also got skin necrosis and infection. As I was talking about, we've got alpha-1 receptors, and we generally think about those as we activate those. They cause vasoconstriction and increased blood pressure. And so the alpha-2 agonist effects of xylazine, it's not completely selective for alpha-2. It will act sometimes on alpha-1. And depending on where people are using, what site or the method that people are using opioids with, if they're injecting into their skin, that can actually cause vasoconstriction at certain places that has led to a couple of big cases of skin necrosis and infection. But these are some of the things you might see. I also wanted to note that with the overdoses that they examined in the Morbidity and Mortality Weekly Report, none of them were xylazine by itself. All of the overdose deaths also had other substances associated with those. Okay. I wanted to, all right, so this next slide, this is a trigger warning because this next picture, the next slide is a picture of some of these gangrenous, or not gangrenous, but some of the skin necrosis that you could see. This is from one of the case reports that I found, and it is pretty graphic. So just real quick, I was just shocked at how this developed bilaterally on this patient. So we've got one from each side of the same patient that had injected, had been attempting to inject opioids in their leg, and it was also laced with xylazine. So moving on a little bit more about this. So here are the more breakdown. Here's more of the breakdown of that study that I was talking about. So 1.2% were xylazine positive, other drugs involved 100% of the time. Fentanyl was involved in 98% of the cases, which is one of the reasons I keep bringing up fentanyl and not just opioids itself. Cocaine about 30%, and heroin a little over 20 or at 26% involved in those opioid overdose deaths. And as I mentioned before, this is probably likely underestimating how many patients or how many people are actually using xylazine or have been exposed to xylazine through the lacing of other drugs. It's simply that we don't really necessarily test for this in toxicology labs just yet. It's not necessarily routinely run by coroners, although in places like Pennsylvania, they have actually added it. And I don't know if it's county by county or statewide, but they've added it to the post-mortem toxicology panel just to get more numbers on that. So kind of wrapping this up, big picture, it is, as a reminder, a veterinary sedative that we see used for animals, used sometimes intentionally by patients to prolong the euphoric effects of fentanyl, sometimes unintentionally when it's used to lace drugs that are bought off the street. It increases the risk for opioid overdose when used concomitantly, can cause respiratory depression, hypotension, CNS depression, and hyperglycemia. And it's becoming more popular as a drug to misuse. And I will say there's a little caveat to that, which is we don't know if it's becoming more popular to misuse or whether it's lacing more drugs that are out there or whether we just weren't detecting that people were using xylazine before. One other thing I meant to mention earlier is that in order to buy xylazine legally, you do have to have a veterinary license. So there may be ways to get a hold of it online, maybe from other countries and getting it shipped in, but you can't just walk into your vet and ask to buy some